If you're an early stage stroke survivor who has little to no movement in your affected leg and you're having trouble sitting and standing, then this in-bed workout is for you. Today, I'm going to walk you through a caregiver-assisted and in-bed workout designed for stroke survivors in the earliest stages of recovery. To complete these exercises, you only need 3 things. You just need a flat surface to lay down on, a grocery bag, and a helping hand willing to help you with some of these exercises. We're going to start off with some isometric hip and knee presses. Start with the survivor lying comfortably on their back, and the caregiver is going to bend their affected leg so the foot is flat on their bed, and they're going to hold their ankle down while supporting the side of their affected knee. Now survivors, with the caregiver supporting your leg, press your foot down into the bed and hold for 3 seconds. And now relax. We're going to repeat this exercise 10 times, holding each press for 3 seconds. Caregivers, remember your job is here to stabilize the leg and encourage movement. In survivors, even if your leg isn't moving yet, that's okay. What matters is the intention behind the effort. Every small attempt helps improve awareness, rebuild strength, and reconnect the brain to the body. Next, we're going to work on leg slides to help improve hip and knee mobility. Start with the survivor lying comfortably on their back and place a grocery bag or slick surface under their affected foot to reduce friction and make it easier for them to move. As a caregiver, position one hand on the outside of the knee and the other hand on top of the ankle to guide the movement. Make sure the leg stays in good alignment and avoid letting it rotate outward. Now survivors, try to slide your heel back up towards your butt. And the caregivers, you can assist in this motion gently, pause briefly at the top, and then slowly guide the leg down until it's straight again. We'll complete 10 slow and steady reps of this movement. And caregivers, remember, your job here is to support and guide, not to take over. Move slowly and only assist as much as needed. And survivors, don't worry about perfection here. Each attempt you make, even with help, is a powerful step towards rebuilding control and confidence. And now let's activate the muscles along the inside and outside of the thighs. Start with the survivor lying comfortably on their back, knees bent, and feet flat on the bed. Caregiver, place a small pillow between the survivor's knees and gently hold the outside of their knees to support and resist as they go through these movements. Survivors, I want you to gently press your knees into the pillow like you're trying to squeeze it and hold for 3 seconds. And now relax. And reverse the direction and press your knees outward like you're trying to open your legs, again holding for 3 seconds. And relax. Alright, let's do 10 reps of these. First, squeezing in for 3 seconds, then pressing out for 3 seconds. Let's move on to the 4th exercise of bridging. This is a great exercise for building strength in the hips, glutes, and core. Keep the survivor in the same position as the last exercise, but you can remove the pillow. The caregiver can support their affected leg by placing one hand on their ankle and knee. Now survivors, what I want you to do is press your heels through the bed, tightening your glutes, and trying to lift your hips up off the bed. Even just a few inches is good. Hold that bridge at the top for 3 seconds, then slowly lower back down and continue for 10 reps, squeezing at the top for 3 seconds. Don't fixate on how high up you're lifting your hips. Even a small shift off the bed is progress. Now let's move on to the next exercise of ankle pumps. Start with the survivor lying on their bed, legs straight and relaxed. Caregiver, position yourself at the foot of the bed, gently holding the survivor's foot in angle, one hand under the heel and the other across the top of the foot. Once in position, the survivor can press down on their foot like they would a gas pedal. Hold that press for 3 seconds, then reverse direction and bring your toes back towards you, again holding for 3 seconds. If the survivor has little to no movement, caregivers, you can go ahead and assist the foot gently in each direction as the survivor mentally practices this movement. We'll complete 10 reps total, gradually allowing the survivor to do more of the work as they're able. Now let's work on rolling to improve your core strength. To complete this exercise, start with the survivor lying flat on their back. Caregiver, bend the knee of their affected leg so their foot is flat on the bed. They'll also want to position their affected arm across their chest. Survivors, if you are able, try help by turning your head to the direction you're rolling, and if possible, reaching with your unaffected arm across the body. And push with your affected leg into the bed to move your hips over. Even a small effort makes a big difference. Caregivers, once you feel them initiate movement, you can assist their movement by guiding them gently into a side-lying position. Once rolled onto the side, pause and hold that position for 2 to 3 seconds, and then assist the survivor back to the starting position. And now let's work on our last exercise of knee drops to continue strengthening your core. Start with the survivor lying comfortably on their back with both knees bent and feet flat on the bed. Survivors, if you are able, begin by moving both knees together to one side of the bed. Once you've reached an end point, pause for breath, then slowly guide the knees back to the center and over to the other side. Repeat this movement 10 times, moving slowly and breathing steadily. Even if you only feel small movements, it's helping you reconnect your upper and lower body, strengthening your core, and preparing you for sitting and standing. And that's it. You just completed 65 challenging repetitions, bringing you that much closer to your goals. Even if you feel like these repetitions were small, to your brain, they were huge. And remember, these exercises are not just about rebuilding movement back into your leg or core. It's about rebuilding the entire system that controls it. So give yourself some time and don't forget to practice. So when you're ready, the next step is relearning how to sit and balance again. So check out my video over here on assisted sitting balance retraining, and I'll see you over there.